When you first wake up in the morning and swing your legs over the side of the bed, do you ever glance down at your feet? Most people don't. They shuffle toward the bathroom, start the coffee, begin another ordinary day without a second thought about what's happening below their ankles. But here's something that could genuinely change your life, or even save it. Your feet are speaking to you every single morning, sending urgent messages from your cardiovascular system, and almost nobody is listening. I have spent more than 2 decades in medicine, and if there is one thing I wish I could tell every single person over the age of 55, it's this. Your feet are one of the most honest indicators of heart health you will ever find. They don't lie. They can't hide what's happening inside your arteries, inside your veins, inside the very chambers of your heart. When something goes wrong in your cardiovascular system, your feet often know about it weeks, sometimes months, before you feel the first flutter in your chest or the first squeeze of pressure. The trouble is, most people don't know how to read these signals. They dismiss the puffiness as standing too long. They ignore the color changes as just a quirk of aging. They explain away the tingling, the coldness, the strange sensations as nothing important. Today, I am going to teach you exactly what to look for when you wake up tomorrow morning. I'm going to show you the warning signs that cardiologists recognize immediately, the ones your own doctor might not have time to explain during a rushed 15-minute appointment. By the time we're finished here, you will never look at your feet the same way again. Let me take you back to something that happened in a hospital corridor not far from where I trained as a young physician. There was a man named Walter, 68 years old, a retired electrician who prided himself on never missing a day of work in 40 years. He came into the emergency department one Tuesday evening because his wife insisted. She had noticed something strange about his feet over the past several weeks. In the morning, they looked puffy, swollen, almost like someone had inflated them overnight. By evening, the swelling would go down somewhat, but his feet had started turning a dusky, purplish color whenever he sat for too long. Walter himself had barely noticed. He thought it was just age catching up with him, maybe a sign he needed to lose a few pounds. What the emergency physician found that night changed Walter's life forever. His heart was struggling. The right side of his heart had been weakening for months, possibly years, and nobody had caught it. The fluid backing up in his system had nowhere to go except down, pooling in the lowest parts of his body, his feet and ankles. That puffiness his wife had noticed wasn't a cosmetic issue. It was his heart crying for help in the only way it could. Walter was lucky. His wife paid attention. Most people aren't so fortunate. They walk around for months, sometimes years, with feet that are screaming silent warnings, while the damage to their heart compounds day after day. The connection between your feet and your heart is not some alternative medicine theory. It is basic cardiovascular physiology that every medical student learns in their first year. Yet somehow this knowledge rarely makes it to the people who need it most. Your heart pumps blood through roughly 60,000 miles of blood vessels. 60,000. That's enough to wrap around the earth more than twice. Your feet sit at the very end of this incredible network, the farthest outpost from the pumping station in your chest. When something begins to go wrong anywhere in that system, the effects often show up first in those distant territories. Gravity makes your feet the collection point for every dysfunction, every slowdown, every failure that happens upstream. Now here's where understanding deepens and the picture becomes clearer. There are specific visual changes in your feet that correspond to specific cardiovascular problems. And once you know what to look for, you cannot unsee them. The first major warning sign is what I call the morning pillow effect. You wake up and your feet look like someone stuffed them with cotton overnight. The skin appears stretched, shiny, almost glossy. When you press your thumb into the top of your foot near your ankle and hold it there for about 5 seconds, you leave behind an indent, a pit that takes several seconds to fill back in. This is called pitting edema, and it happens when fluid accumulates in the tissue faster than your lymphatic system can drain it away. Now, occasional foot swelling can happen to anyone. Standing on your feet all day, eating a particularly salty meal, sitting through a long flight, these are normal. What's not normal is waking up this way consistently, especially if the swelling has been gradually worsening over weeks or months. When your heart's pumping efficiency drops, blood backs up in the venous system. The pressure increases in those tiny capillaries in your feet and ankles, and fluid gets pushed out into the surrounding tissue. Your kidneys, sensing that something is off, often try to compensate by retaining even more fluid, which makes the problem worse. It becomes a vicious cycle, and your feet are the visible evidence of the internal struggle. The second warning sign involves color, and this one is more subtle but equally important. Healthy feet, when you first wake up in the morning, should have a fairly consistent pinkish tone. They should look alive, well perfused, the color of someone whose blood is flowing freely. But if your feet appear pale, almost whitish, especially on the tops and around the toes, it can indicate that arterial blood flow has become compromised. The blood isn't reaching your feet the way it should. On the other end of the spectrum, if your feet appear dusky, with a bluish or purplish tint, especially around the toes or the edges of your feet, this suggests that blood is arriving but not being pumped away efficiently. It's pooling, and the oxygen in that blood is being depleted while it sits there. Either of these color changes, whether too pale or too blue, deserves immediate attention. The biology behind these warning signs is actually fascinating when you understand what your body is trying to accomplish. Think of your cardiovascular system like the plumbing in a tall apartment building. Your heart is the pump in the basement, responsible for pushing water up to every floor. The arteries are the pipes carrying fresh water upward, and the veins are the return pipes bringing used water back down to be recirculated. Now imagine the pump starts losing power. It can still move water, but not with the same force it once had. The apartments on the top floors might notice lower water pressure first, but the really visible problem shows up in the basement, where all the return water starts backing up because the pump can't cycle it through fast enough. Your feet are that basement. They're the lowest point in your system when you're standing or sitting, and they bear the consequences of any pumping problems immediately and visibly. What makes this even more critical is that your feet require an enormous amount of blood flow relative to their size. The tissue in your feet is metabolically active. It's constantly demanding oxygen and nutrients, and it's constantly producing waste that needs to be carried away. When blood flow becomes restricted, or when the return flow becomes sluggish, the tissue in your feet begins to suffer in ways you can actually see and feel. Beyond swelling and color changes, there are other warning signals that warrant attention. Temperature differences between your feet can indicate circulation problems. If one foot feels noticeably colder than the other when you wake up, it could suggest that blood flow to that extremity is compromised. Symmetry matters here. Both feet should feel roughly the same temperature. Persistent coldness in both feet, especially if it's a new development, can indicate overall circulatory decline. The sensation in your feet also tells a story. Waking up with numbness, a pins and needles feeling, or a strange buzzing sensation in your feet could be related to nerve damage from poor circulation. When your heart struggles to deliver adequate blood to the periphery, the delicate nerves in your feet are among the first to suffer. Let me be direct about what this means for your everyday life, because abstract medical knowledge only matters if it changes how you live. If you recognize any of these signs in yourself, the very first thing you need to do is stop explaining them away. The human mind is remarkably creative at rationalizing warning signs, especially when the alternative is confronting a potentially serious health problem. You might tell yourself the swelling is because you ate too much salt last night. You might decide the color change is just because the room was cold. You might attribute the numbness to sleeping in a weird position. Some of these explanations might occasionally be true, but when these symptoms become patterns, when they appear morning after morning, week after week, rationalization becomes dangerous. The second thing you need to do is start documenting what you observe. Take photographs of your feet first thing in the morning, before you've walked around or done anything to reduce the swelling. Do this for a week or two. Note the date and any relevant circumstances. What you ate the day before, how you slept, your activity level. This documentation becomes invaluable when you speak with your physician because it transforms vague complaints into concrete evidence. Doctors respond very differently when a patient says, "My feet have been a little puffy lately," versus when a patient shows them 2 weeks of photographs demonstrating progressive bilateral edema that's clearly worse in the mornings. The third practical step is to pay attention to associated symptoms that might seem unrelated. Are you waking up in the middle of the night to urinate more frequently than you used to? This can be a sign that fluid accumulated in your lower body during the day is being redistributed when you lie down, signaling your kidneys to process the excess. Are you feeling more winded than usual when climbing stairs or walking uphill? Shortness of breath with exertion combined with foot swelling is a combination that should prompt immediate medical medical evaluation. Are your shoes feeling tighter than they used to, even though you haven't gained weight? This is often how people first notice foot swelling. Their reliable footwear suddenly doesn't fit the same way. Here's something most people never consider, and it might be the most important point I share with you today. Your feet can warn you about heart problems years before you experience the classic symptoms like chest pain or shortness of breath. Years. Cardiovascular disease is often called a silent killer because it progresses without dramatic symptoms until something catastrophic happens. But it's not entirely silent. It whispers. And one of the places it whispers loudest is in your feet. Research consistently shows that peripheral signs of cardiovascular dysfunction often precede central symptoms. Your heart might be struggling to maintain adequate output, but because it's such an adaptable organ, it compensates and compensates until it simply cannot compensate anymore. Meanwhile, your feet, those honest messengers at the far end of your circulatory system, are showing you exactly what's happening. There are protective actions you can take starting tonight. Elevating your feet above the level of your heart for 20 to 30 minutes before bed can help reduce fluid accumulation overnight. This simple positional change allows gravity to assist with venous return rather than fighting against it. Reducing your sodium intake makes a measurable difference for many people. Sodium holds fluid in your tissues, and limiting it to reasonable levels helps your kidneys manage fluid balance more effectively. Staying consistently hydrated might sound counterintuitive when we're discussing fluid retention, but adequate hydration actually helps your kidneys function optimally. Dehydration causes your body to hold on to whatever fluid it has even more desperately. Compression socks, the kind that provide graduated pressure, can support venous return during the day and reduce the fluid accumulation that shows up in your feet by morning. These aren't just for long flights. For anyone experiencing early signs of circulation problems, they can be genuinely therapeutic. Movement throughout the day keeps your calf muscles active, and those muscles act as secondary pumps, helping to push blood back up toward your heart. Prolonged sitting, which has become epidemic in our modern lifestyle, is devastating for peripheral circulation. I want to speak directly to you now, friend, because what I'm about to say is the reason I felt compelled to share this information. I have seen too many people walk into hospitals with advanced heart failure who, when we reviewed their history carefully, had been showing signs in their feet for months or even years beforehand. They just didn't know. Nobody had told them what to look for. Nobody had explained that their body was sending distress signals that could have prompted earlier intervention, gentler intervention, intervention that might have prevented the crisis that finally brought them to our doors. Your feet are not just the things you stand on. They are windows into your cardiovascular system, mirrors reflecting the state of your heart's function. Every morning when you wake up, you have an opportunity to check in with your body in a way that requires no special equipment, no medical degree, no appointment. You just have to look. You just have to pay attention. Dr. Albert Winslow has talked many times on this channel about listening to your body's signals. And this is perhaps the most accessible example of that principle in action. If your feet look puffy, discolored, or feel different than they used to, please don't wait. Please don't assume it will get better on its own. Please don't let months slip by while you rationalize and delay. Make an appointment with your doctor. Show them what you've observed. Ask specifically about your cardiovascular health. Push for an evaluation. Because catching a heart problem early, while it's still whispering through your feet rather than screaming through your chest, can mean the difference between managing a condition and being overcome by one. You deserve to have every tool possible for protecting your health. Now you have one more. Use it. And if there's someone in your life who needs to hear this, someone over 55 who might not be paying attention to these signs, please share this with them. It could be the most important thing you do for them today.